Good afternoon, everyone. On behalf of Ex-Health community and on my own behalf, I wish to extend a very warm welcome to this very important gathering, being part of our regional webinar series titled Strengthening the Health Workforce, Strategic Deployment, Integration and Motivation. Ladies and gentlemen, this webinar comes at a pivotal moment for our region. Health systems across the EXA region are under increased strain. We are not only grappling with recurring and emerging epidemics like cholera and COVID, but also with the ongoing endemic diseases such as HIV, TB, and malaria. These are layered on top of fragile health infrastructure, aging supply chains for health commodities, and significant gaps in human resources for health. Ladies and gentlemen, a recent analysis shows that sub-Saharan Africa has only 3% of the world's health workers, but bears 24% of the global disease burden. In many of our member states, the doctor to population and nurse to population ratios falls far below WHO recommendation. Ladies and gentlemen, these structural weaknesses are further intensified by economic pressures, debt crisis, political transitions, and demographic shifts, including rapidly growing urban population. One of the most visible and most urgent consequences of this pressure is the widespread motivation, attrition, and brain drain of our health workforce. Health professionals are overworked, underpaid, and in many cases not equitably distributed, especially between urban and rural communities. This has serious implications for access, quality, and equity in health service delivery. Ladies and gentlemen, that's why today's webinar is not just timely, but it's essential. We are gathered here not only to identify challenges, but to co-create realistic, context-sensitive strategies that can strengthen the backbone of our healthcare system, which is the health workforce. We must consider innovations in the workforce planning, incentives, task sharing and shifting, and community integration. We must also make a deliberate shift towards revitalizing primary health care as the engine of universal health coverage and health system resilience. This webinar provides a platform to mobilize regional expertise, share emerging best practices, and build inter-country solidarity in addressing these workforce issues. We must particularly be pleased to have with us today a diverse and yet highly experienced group of participants from ministries of health, public health institutions, academia, research institutions, professional associations, and all our key and strategic partners who are here today. Ladies and gentlemen, your presence here signals a shared commitment to building sustainable and resilient health systems across our region. Systems that put people at the center and that recognize health workers not as a cost but as an investment. Let us use this space to chart a path towards the future where no community is left behind and no health worker is unsupported. Ladies and gentlemen, I now look forward to the keynote presentations and panel discussion that will follow, and to the ideas and energy you'll bring to this conversation. I thank you very much.